This information is presented for educational purposes only. Nothing presented here should be construed as medical advice and or as a replacement for allopathic and official medicine. This information is not intended to diagnose, treat, mitigate, or cure any condition. If you have a medical condition, seek the advice of a competent healthcare provider. Usually, physical reasons addressed for chronic back pain are skeletal irregularities, injuries, problems due to degeneration, job-related factors, and the like. But what if there was also something else? The first to point out the possibility of a relationship between a mental and emotional state, the mind-body connection, and the experience of a persistent pain and discomfort was the late Dr. John Sarno. He was a professor of rehabilitation medicine at New York University School of Medicine, and also an attending physician at the Howard Rusk Institute of Rehabilitation Medicine. His findings were derided by his medical peers at that time, and his theory didn't have much influence on medical research during his lifetime. Now, from the NLP and especially from the timeline therapy's point of view, chronic back pain is a result of chronic dissociation. It requires chronic dissociation to create chronic back pain. Some people live in their heads, they are thinkers, they are highly detached from their emotions and physical bodies. Others live in their bodies, where they are acutely aware of their feelings and sensations. The lack of awareness of one's feelings implies a correlation between the two, as Dr. Sarno predicted. Mind influences the body. So by relearning how to access both, meaning association and dissociation, and especially how to release the negative emotions of which one is not aware of, but trying to avoid by dissociation, that hurdle is not only bypassed, but completely eliminated. Furthermore, from the NLP perspective, chronic dissociation is based on a strategy, believe it or not, or more precisely, a lack of a strategy for feeling the emotions in the moment. Even if a person is told, you should feel your emotions, if they don't have a strategy for doing so, they can't, and the pain persists. But by finding out and changing that strategy, both NLP and timeline therapy can assist the person to get better in feeling their kinesthetic internal, meaning to experience their emotions. Now, if Dr. Sarno was correct, then back pain is based on negative emotions. What could that be? Stress, anger, sadness, fear, guilt, anxiety, any other negative emotions of a similar type. So timeline therapy, as a technique, simply allows people to let go of negative emotions from the past. So the negative emotions the client is avoiding unconsciously, because obviously they feel bad, but which are involved in the mind-body connection, mind-body relationship of creating back pain, disappear. All those negative emotions disappear. So these are just some of the skills from the NLP practitioner and master practitioner training, which everyone can master. In conjunction with the medical advice, of course, and the protocols, both NLP and timeline therapy can assist in alleviating the back pain, thus restoring more functionality and relieving pain. Whether the pain is in our heads, as Dr. Sarno affirmed, or not, people who choose to master these skills have found that somehow the pain is far more manageable and can also even completely disappear. So cheers to the power of the mind.